Salutations viewers, this is Avery, and so today I wanted to do a video about MRIs and CT scans. This isn't an informational video really, it's not going to go into what MRIs and CT scans are, but it's going to be going through what to expect when getting one. So this is for people who have anxiety about having them or are unsure about what's going to go on. I've had quite a few MRIs and 2-3 CT scans. I just had one recently when I was in the ER for a headache, which is a very interesting story. Once again, pituitary related. So if you guys have watched this channel before, you know that I had a pituitary cyst thing in my head. It has now been diagnosed as a prolactinoma, and they found it by an MRI. I remember talking to my doctor about it and being very, very nervous. I didn't know what to expect. I didn't know if it would hurt. I didn't know how long it would take. And she prescribed me some anxiety medication that I was supposed to take in half an hour beforehand, which I did. And I took it and I fell asleep after the MRI. It didn't do a thing. So hopefully this would be helpful for you so you don't have to take any medicine. Okay. MRIs are much, much longer than CT scans. CT scans can be, I think, mine have been maybe like just 2 minutes. I think one was like 5 minutes. I think they're much longer. I've only had my head examined, so I think they're much longer if it's your whole body. I mean, it's not, oh my god, these kids. It's not that much longer if it's your whole body. They're just still much faster than MRIs. And what they do is, if you're having contrast, they will lay you down and they will give you an IV wherever your IV fits. I usually get mine in my elbow or the back of my hand because I have really tiny veins. You can see my bruises from my last IV. And so they'll lie you down and they'll give you contrast. Now, if they're using the one they gave me, which I think was iodine or something like that, something that sounded like it shouldn't go into my body, you'll feel like you're peeing. I was really concerned. I'm like, no, you need to check my shorts. It feels like I'm peeing. For some reason, this stuff is really warm, and when it gets down there, it feels like you're wetting yourself. Don't worry, you're not. So once that's kind of circulated in your system, they'll slide you into the MRI, the CT machine, and there'll be a couple noises. They're not very loud. You will need to wear some lead, and they will wrap it over you, or at least they did at the U of M for me. And that's it really. They'll pull the IV out and you're good to go. MRIs are a little different, and usually you have to change into a gown. I've never had to change into a gown for a CT scan. And what they'll do is you take off all your medals like you do with a CT scan. I forgot to mention that. You take off all your jewelry, all your medals, and you'll get into a gown, and usually only a gown or just your underpants. And then you will be taken to the MRI room, and if you're getting contrast like I did, they will give you an IV. This contrast is different. It tastes metallic. I don't think I tasted that. Oh, I did taste the iodine, yeah, but the MRI contrast was colder and I could taste it more. And you'll feel it going up your arm. It's very chilly. So usually they'll give you a warm blanket, or you can ask for one. I know that my hospital supplies warm blankets for you. And the room's going to be very cold, so beware for that. Make sure that they give you a blanket, because you'll shiver a lot if they don't. Because it's kind of nerve-wracking every time to stay still, and, you know, forcing yourself to stay still will kind of make your body twitch. Or at least that's what it does for me. So keep warm. The IV might swing around a bit if they wheel the cart away, so you're going to have to hold on to it, but they'll probably give it to you. And they'll give you a squish ball, just this weird looking ball thing that you hold on to, and if anything goes wrong, if you're feeling uncomfortable, if your IV starts to blow out, if you're just too scared to continue, you can squeeze it and they'll come in and they'll stop everything. I've never had to do it before because I've always been very, very calmed during the whole interaction with my nurses and the MRI thing, but yes, so they'll give you your IV, they might give you your contrast beforehand. They would run tests on me without contrast, and then they would pump it in, and then with contrast. So they may or may not do that. And then they'll give you your squish ball, and they'll put a warm blanket on you, and the table's gonna rise. The tables rise up after getting on them, so the CT scan ones are always very bumpy for me. I don't know why. My MRI ones are very good, and they rise up and they'll start scooting you back. For an MRI though, they will probably put padding underneath your head to keep it still if you're getting your head examined, and then they'll give you earplugs. They'll give you earplugs anyway, and probably some headphones to go over that, because MRIs are very, very loud, and you'll hear them crystal clear even with the earplugs and headphones, and make sure that they're in your ears properly, or else they're really, really loud. Then for head MRIs, they'll put over a cage over your head with a little window so you can still see out of it. I've never been claustrophobic, but I can see where people who have problems with tight spaces would feel claustrophobic, so if you do experience claustrophobia, I would talk to a doctor or MRI specialist. I don't know what other options are. These are just for basic MRIs and CTs. Both the machines, by the way, look like donuts, with like a lollipop stick through them. So that's a good, funny way to think of them, I guess. And once you're all situated and your knees are raised up to help keep you still and just comfy, really, they're kind of squishy pads, they will push you back into the machine. CT scans have lasers to align, not cut your head open, to align your head to make sure it's in the right position in your body. So you'll close your eyes. Make sure you close your eyes because they're really bright. And they'll situate your body, tell you what to do, and it's over pretty quickly. MRIs can take quite a while. I remember I had one that was about an hour or something like that, and so make sure if anyone's bringing you, tell them to bring something to do. Anyways, so that's about it for an MRI and CT scan. They'll pull you back out and get you unplugged if you're having contrast. I don't know what needs contrast and what doesn't. I guess it kind of depends on what your condition is and what your doctor wants. And if you're getting just checked up, good. That's always a good thing to do because it sees a lot. MRIs are much clearer than CT scans, but CT scans are quick, and they give you the general basis, I guess. I don't know what to say. Yeah, so maybe one day I'll post my MRI photos on my Tumblr or something. Yeah, so don't be worried about MRIs or CT scans. They're really not that bad, and your life will continue afterwards, and I've never heard anything horribly wrong with them. I have heard, radiation's gonna kill you, but we're all pretty radiated right now. It's not gonna kill you, and they do more good than bad, if you think about it. Yeah, anyways, I hope this helps anyone who's worried about an MRI or CT scan or didn't know what to expect. Always ask for help or for, reassurance from your nurses, because that's what they're there for. They're there to help you and make sure you feel comfy and not worried about anything. I actually kind of enjoy them sometimes. They're kind of relaxing, although the MRIs do make some loud clicking noises, but other than that, it's fine. The noises are weird. I should have mentioned that. They're kind of funny. You can make some dubstep with them. And that's the thing to do while you're in them. Think about the dubstep beat. And rock out. Anyways, thanks for watching. I know this is a little break from all my girly, feminine makeup videos, but it's a nice change of pace. So yes, subscribe to our channel if you haven't already. We post pretty cool stuff, and I do it with Ben, and Ben's doing pretty cool stuff, and he's saying smart things as always. So yes, thank you for watching, and I will talk to you guys later. Bye-bye. I'm just gonna walk around, turn my camera off and stuff.